Jill writes, when I have to teach my patient about their medications, I'm not sure how to narrow it down. What information do I have to include? Jill, let me tell you a story.
For real world answers to all of your questions on nursing school and life as Dr. Wife.
Denise, a sophomore nursing student, was preparing to give medication teaching for the first time. Denise looked up everything she could find and after 3 pages of notes wondered how she was going to explain it all without losing her patient's attention. She had an entire page of adverse effects and was afraid that telling him everything that could happen would actually cause more harm than good. A nurse on the floor empathized with Denise, took her aside, and gave her this quick lesson on how to teach patients about medications. Here's what she told Denise. When you teach patients about medications, condense your lesson to these 5 things. First of all, tell your patient what you are giving him. This could be the generic or trade name or even the class of medication. If the patient is unfamiliar with this drug, you might include all 3. The second thing you tell your patient is why you're giving it to him and why this was ordered in the first place. If he's taken this medication before, he will probably already know, but if he doesn't, this will help him understand. Third, tell your patient what this medication will do. You're very briefly explaining the basic mechanism of action here. You're telling your patient how the medication is supposed to help him. The fourth thing you tell him is what could happen with this medication. This is where you highlight the most common adverse effects that most people experience when they have an adverse effect to this drug. And finally, you tell your patient what you're going to do about these potential risks. This is where you elaborate on any monitoring or assessments you'll need to make during and after administration. That day, Denise told her patient she was giving him lisinopril, a blood pressure medication because of his history of hypertension. This medication would lower his blood pressure, but it's also possible that this medication could cause low blood pressure, an allergic reaction, or a change in his potassium level. She told him she would be checking his vital signs and monitoring his blood pressure and his labs. If he had any adverse effects, she told him to press his call light and let her know. She followed up the teaching by giving him a handout on the medication to read through later. Denise learned that medication teaching is important, but teaching at the bedside is challenging and not always the best time or way for a patient to learn. She learned to give just the most necessary and pertinent information verbally and give handouts for the rest. Jill, I hope Denise's story was helpful. Please like and share this video. And as always, if you have a question about nursing school or life, ask Dr. Wife.
Nursing school won't feel so tough. Helping others won't be so rough. You are confident, compassionate, and so much more. But sometimes it feels like you're not too sure. So when